Good evening, class. Welcome to Kinese 302, the kinesiotaping method. Today our class is going to cover the circulatory and lymphatic correction of the knee. My name is Charlie Ramos, and I'll be your instructor for tonight. So first, let's cover some learning objectives. First, we want to choose the correct KT application. Next, we want to apply the correct amount of tension on the KT for lymphatic drainage. And third, we want to apply the correct KT technique for the knee. So we want to make sure we understand these three aspects of lymphatic drainage for the knee, and we'll get to practice all of these in our lab after we cover all of this material. So first of all, let's get a little bit of background of when we're going to be using this kinesiotaping technique. As you can see here, we have a contusion to the knee, and that's when you want to use this kinesiotaping technique. There's different other techniques that you can use or different cuts that you can use, but today what we want to cover is that acute injury, that first 3 to 5 days when the athlete or your patient has sustained an injury. So for that, let's just get a little bit of background about the tissue healing process, and that in turn will help us really understand why we're using the kinesiotaping method here. So as you can see here, we have 3 different phases that make up the tissue healing process: the inflammatory response phase, the fibroblastic repair phase, and the maturation remodeling phase. And as you can see with our little diagram here, the inflammatory response phase happens immediately, or it begins immediately, and it can last up to 48 to 72 hours. So that's the phase that we really want to focus on here, because once we start getting proliferation or scarring and then the maturation phase, this technique, it will not hurt the athlete or the patient, but it's not going to be the optimal tape job for someone who, let's say, is already um, back to their normal activities, or someone who is playing their sport again. There's going to be other tape jobs more appropriate for someone like that. So as we move along here, let's look at some of the signs and symptoms. You're going to have obviously redness, swelling, tenderness, and as you can see here, the athlete's ankle here is pretty swollen, so they're going to be pretty limited in their range of motion. And as you can see here, this phase is going to last 48 to 72 hours, but the symptoms are going to last a little bit longer. They can usually last, up to 2 weeks sometimes. And it's during this period that we want to get rid of that swelling, because that will make their therapeutic exercises, all of the range of motion, their strengthening exercises, a lot more easier. And that's what we're trying to do. We're trying to make that rehabilitation process more efficient. So what about kinesiotape? Is that going to be the tool that is going to help us speed up that process? Well, according to the literature, that the answer to that question is still somewhat inconclusive, because some studies are saying that kinesiotape alone is not going to it doesn't make any difference, but then other studies that combine kinesiotape with other rehabilitation techniques say that it does make a difference. So here we have some studies. So for example, Pekevas and colleagues, they combined kinesiotape with complex decongestive therapy in order to treat females that had just had a mastectomy and then sustained lymphedema. And they showed that after 10 days of doing this treatment, this combination of treatments, they had a bigger decrease in edema after 10 days compared to the group that only got the CDD therapy. Then we have Aguilar, Ferrandes, and colleagues. They showed that they could reduce venous symptoms, pain, and increase gastrocnemius activity in patients with chronic venous insufficiency. However, the total amount of edema was not shown to be significantly decreased when using KT compared to, let's say, a placebo tape job. And then our third study shows that there was no difference in using KT alone compared to a placebo tape job. And in this study, they only applied the tape for 3 days, and they didn't use any other therapeutic exercises or rehabilitation methods. So all that to say that when using the kinesiotaping method, any of the techniques, you have to understand that as a clinician, you don't want to just use this as your only tool. I think any rehabilitation tool should not be used exclusively and say that it's going to be your cure-all. Like if you're doing that, then that's not being a good clinician. That's just kind of going with whatever tool is in style at the moment. You want to make sure that you assess your patient correctly and that you know when it is appropriate to use, in this case, the kinesiotaping method. So let's move on to how we're going to use the kinesiotape now. So let's say we do have a patient with a knee injury and we want to use the kinesiotaping method. Well, all of you should have read the recommended or the suggested readings for this week. So we'll take our first quiz based on that reading. So as this loads up, get your phones out and open up your text messaging application. And you're going to text Charles Ramos 572 to the number 22333. And then this will get you onto this online poll. So from here, we have the question: what is the correct KT application for swelling? We have A, which is I-strip application, B, fan strip application, C, Y-strip application, or D, the X-strip application. So let's see what our students are answering now. And it looks like almost everyone is answering B, the fan strip application. And that would be correct. So the fan strip application as shown here is the length of this is going to depend on the size of the person and also the body part that you're taping. In this case, we'd be taping the knee. So our anchor, this would be the anchor, would be 1 to 2 inches long. Then you would need to cut 6 tails, and this is what gives it that name, the fan tail, or a fan strip, because it looks like a fan. The other thing to note about this application is that the ends are laid down with no tension, as well as the anchor. So these two parts of the tape job, the anchor and then the very last end, that's about like the last ½ inch of the tape. All of these are laid down with no tension. Everything else in between is going to be the treatment zone. Okay, so we just went over the first learning objective, was to choose a correct KT application. Our next objective that we're going to cover is apply the correct amount of tension on KT for lymphatic drainage. So go ahead and open up your phones again, and we have our second quiz here. So it says, how much tension is applied to a lymphatic correction KT application? A is 0%, B is 100%, C is 50%, and D is 20%. So let's see what our students are going to be answering. So it looks like everyone's answering D, and we have a few A's, so 0% and 20%. Well, both of those answers are correct. The correct tension would be between 0 and 20% that you would apply to the tape on those tails. So lymphatic correction, let's just cover a little bit about what we're supposed to be doing here. So it's used to assist the removal of edema. And the way it does this is once you lay down the tape is going to recoil slightly, and so that creates these wrinkles in the skin, and that's supposed to create these areas of decreased pressure under that skin. And again, just to reiterate, this technique should be used properly. So you should assess your patient properly and make sure that this is going to be the correct technique. You wouldn't use this for someone who, let's say you have a healthy subject who is having some soreness and they're trapezius. This technique may not give you the best results because it's not meant for a spasming muscle. This is more to help with the removal of edema. So we've gone through choosing the correct KT application. We've learned what the correct amount of tension is. And finally, we have to learn the correct KT technique for the knee specifically. So our last quiz here is going to ask us about what the final tape job should look like. So how should a KT lymphatic correction application look like for a knee? So we have A, B, C, and D here. Now you guys should have seen the pictures of what the final product looks like in your textbooks. So this should be really easy, and most of you should answer correctly here. So let's see what you guys answer. And yep, looks like most of you saw that. So it should be B, the one that looks like two fan cut tape jobs crisscrossing each other. So let's go over again the whole technique. So for a knee, when you're trying to induce lymphatic drainage, you're going to create two fan cut strips, and they're each going to be about 6 inches in length. And then you're going to place the anchors above the knee, so more proximal. And each of those is going to be aimed at the nearest lymph node. So that's why you see one anchor pointing out here towards the greater trochanter and one pointing more towards the groin. And then the tails are laid down again with 0 to 20% tension. And as you can see here, our patient has his knee flexed, and that's a position that you want to perform this tape job. And again, these ends here have no tension, just as the anchor has no tension. So that is going to be the complete tape job for reducing edema in a knee or a patient that has a knee inflammation. So just to recap, when using kinesio tape as a supplement to assist in reducing knee swelling, KT will be applied 48 hours the initial injury. So again, we're using this tape for acute injuries most of the time. I wouldn't say exclusively, because there is times where you can use it for chronic conditions. A fan cut will be used, 0 to 20% tension on the tails. The patient will have his or her knee in a flex position, and then the anchors are laid down proximally above the knee joint line. So here are the references that we used for today. And if anyone has any questions before we get started on the lab, please raise your hand and we can get started on that. Otherwise, thank you for taking the time to listen to this lecture.